Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so very pleased you could join us today. My very first guest is the distinguished Dr. Michele Horne, MD, MPH. Dr. Horne, thanks very much for coming on the program.
It's my pleasure.
Dr. Horne, I was just going over your resume, and I understand you are not only board-certified in internal medicine, you're board-certified in occupational health and medicine. Isn't that correct?
That's correct.
So tell me a little bit about your training. As I mentioned before the program to my producer, Jim Vosen and Mary Lou, I'm kind of intimidated by these very brilliant doctors that come on my program. Yale School of Medicine, Masters in Public Health, University of Southern California. Yes, finally, I've got somebody from USC. So you're double boarded in internal medicine and occupational health. So tell me, let's teach the audience how someone gets to be double board certified.
Well, it started off with I went through medical school, and then after my medical school...
So where'd you go to med school?
I went to medical school at the University of Southern California.
At USC.
Mm-hmm.
Yes.
Go Trojans.
Yes. I was chief resident of plastic surgery at USC LA County, and I worked very hard and learned a lot. So you went to medical school there. Oh, let me back up one moment. So you were born in France?
I was born in Verdun, France, yes. I come from a military family. My dad was in the service and retired here.
So you grew up actually in the Monterey area?
I did.
So local girl goes off and makes good and becomes double board certified. So I keep interrupting you. So you went to USC Medical School.
Mm-hmm.
And then from there, what did you do?
Then after medical school, I went to do my residency, and I did my residency training at Yale University.
Yale, that's a high-pressured program.
Yeah, but I'll have to tell you, it was really a big awakening for me, going to the East Coast and dealing with the snow, having grown up here in California.
Well, of course. I mean, snow, to those of us who grew up in New England, snow is just part of the environment. It's just something that we learn to deal with. So for me, it was a big change to come to California, of course. So you got board certified in internal medicine.
Right. So after I finished my training in internal medicine, I decided I wanted to do a fellowship. Occupational medicine can be done as a residency, but at Yale, it's a fellowship. You have to have either completed family medicine or internal medicine in order to do the fellowship. And so I did the fellowship there, and then after completing that, I took my boards and was certified in occupational medicine along with the internal medicine.
Perfect. So Dr. Horne, I want to make sure that our audience understands what we mean by fellowship training, because it should be clear to them that you got your full you did a full residency in internal medicine, mm-hmm. and you could have gone out, and you do practice some internal medicine, but instead of just going into practice or working for a university or a big corporation as you did, you got additional training, right?
That's
so
correct.
Let's explain to our audience what we mean by fellowship.
So fellowship is postgraduate training. It's beyond the initial training with your residency training. It can be anywhere from 2 to maybe even 5 years, depending on what the subspecialty is in. In this case, with occupational medicine, the focus was more on the health of populations as opposed to the health of the individual. With internal medicine, you really focus on the individual person, but with occupational medicine, you're looking at a population, be it a work population, or it could be a population, it could be within a corporation, it could be within a government entity, it could be in a country, like with the CDC or World Health Organization. So it's looking at groups of people and how their health is impacted.
So you actually have, as we said, you have a master's in public health that you got from Yale.
That's correct.
In addition to being board certified in internal medicine and occupational medicine. See, there I start to feel intimidated again by very smart doctors. So, Dr. Horne, tell us about what you're doing now. I understand you're with Dr. Sato, who's an orthopedic surgeon, and with Dr. Isvaran, right? And
That's
you work
correct.
together.
That's correct.
And I think your group is called Monterey Integrated Sports and Pain Associates. Isn't that right?
That's correct.
So you do a lot of sports medicine.
That's correct. We, in our practice, we do a lot of focusing on sports medicine, but then along with that, we also do primary care medicine. So primary care, taking care of the basics like diabetes, hypertension, asthma, colds, flu, just the basic things.
Okay, so before the end of our segment, I want to ask you if you're taking new patients and if there's a contact number and website, of course. But I'd like to do that before we finish the segment. So let's talk a little bit about sports medicine and what that's all about, because we hear that phrase a lot, you know, that there's a sports medicine group or somebody practices sports medicine, but I'm not sure that our audience really understands what sports medicine is. So let's teach our audience what we mean by sports medicine.
So with regards to sports medicine, we are looking at the health of individuals that are usually athletes or either amateur or professional, and trying to make sure that we keep that individual's body as healthy as possible. And in the case of an injury, we're there to treat that injury and get them back to their baseline so that they can continue to be active.
So I think it's a lot about high performance, isn't it?
That's correct.
And some of the high performance athletes may get some musculoskeletal problems and nutritional needs that more sedentary patients actually aren't concerned with. Isn't that correct?
Correct. They may not be concerned with them, but they will also have some of those same needs.
Now, Dr. Horne, what about people with pain from an acute injury? Do you see a lot of injured athletes or patients?
In our practice, we do see injured athletes. Sometimes, mostly it's strained muscles or sprains, like ankle sprains or a knee sprain. And it's a matter of helping them to treat that injury, which a lot of times requires rest, and maybe exercise to strengthen muscles that are supporting the area that was injured, and then getting them back. And then in that aspect, you may also need some pain medications.
Okay. Well, Dr. Horne, I'm pleased to hear you talk about that. I think one of the important points that we want to convey to our audience is that everyone who gets a certain injury while training for an athletic event or even training for the Olympics or during a game, if they get an injury, it doesn't mean that surgery is required. Isn't that correct?
That's correct.
So I think that you see some concerns and some injuries that cause pain, but they don't necessarily need an operation. Isn't that correct?
That's correct. And so we start off by treating them what we call as conservatively, trying to see if we can get them back to their baseline without surgery. And of course, if they do need it, then we will refer them to the appropriate physicians to take care of them.
Okay, and I believe that in your group and most good internal medicine doctors and sports medicine doctors spend a lot of time talking about prevention. Isn't that correct?
That's correct. In our practice, we truly believe in the wellness of the whole body, mind, body, and soul, and making sure that they understand that we want to keep our patients well, as opposed to taking care of them when they have an illness or injury.
So, Dr. Horne, when I was a kid, not that long ago, I played a lot of sports, and for example, in Little League, we were always concerned with like the pitchers and throwing the ball a lot, that they wouldn't, you know, injure their elbow, and some of the young pitchers were taught that they shouldn't try to throw a curveball until they were like a teenager instead of starting at age 8 or 9 or 10. Do you treat the younger athletes as well as the older athletes?
Mostly in my practice, I should start off by saying internal medicine is really the practice of medicine for adults. My partner, Dr. Isvaran, is family medicine, and so he treats individuals from the cradle to the grave.
Oh, great.
Is what we say. So with that, the younger children, athletes, Dr. Isvaran cares for more so, and I usually just take care of the adults.
Perfect. Well, Dr. Horne, one of the topics that I'd like to discuss and teach our audience about is the importance of nutrition, not only for athletes, but for healthy patients, and also for people who have conditions such as diabetes and hypertension even. You know, when I was growing up, I think we heard every day it's important to eat right. It's important to eat right. But you know, we didn't really know what eating right meant.
Correct.
And then of course we learned about the basic food groups. Every day you should have some fruit and vegetables, and there's dairy, and there's protein, and there's grains, and you should have some of each. And then more recently, I think we're all very concerned about caloric intake and how nutrition can actually affect disease states and health. Isn't that correct?
That's correct.
So let's teach our audience how nutrition can play a role in health, and in particular in your practice.
So I think one of the first places for us to start has to do with the intake of water. And we hear a lot of people saying, how many glasses of water should I take in? And some of us have heard 8 glasses of water, 8 ounces every day. I think now the thought has changed a little bit with that. It doesn't have to necessarily be water, but it should be at least fluids. The only advice I would say with that is to remember that it shouldn't be caffeinated, because if it's caffeinated fluid, that can act as a diuretic. And so for every extra cup of coffee you have, you should have an extra cup of water to replace that. I think the other piece I want to say is, why is it that we need so much water? Well, we're made up of 60% water. And so with regards to our cells and the remaining having the moisture that they need, the mucous membranes in our body, having the moisture that it requires, we need to make sure that we're not dehydrated and we have enough water on board.
Well, Dr. Horne, I guess it's okay if I tell a little personal story. I used to be a very avid runner. I used to do marathons, and one time I got a kidney stone, and it's unbelievably uncomfortable and painful. And it was simply because I wasn't hydrating enough before and during and after I would train for marathons. And I think it's one of the least known but important factors about training and health, is to drink enough water, drink enough fluids, don't you think?
I think so. It's very important. That's why it's at the top of my list. Then besides that, the next piece would be our fruits and vegetables. So they used to always say, make sure that you eat healthy, right? And as you said, no one knew what that meant. But at that time, people were eating a lot of fruits and vegetables. Our lives have changed with the convenience of fast food, and so people aren't getting enough fruits and vegetables. Our lives are much more hectic, and we have this perception that it takes a lot more time to create a healthy meal. The truth of the matter is, just with a little bit of planning, you really can still have the convenience of the fast food with your healthy meals. So I think one of the things I like to share with everyone is, when you create your plate, half of your plate should be pretty much your vegetables, your fruits and vegetables, but mostly vegetables. And we're talking about green leafy vegetables. We're talking about lots of bright colors when you think about your food, because all those nutrients are in the bright colors.
Well, you know, Dr. Horne, when I was growing up, I think most American families ate so much fried food. I think that was the way that foods were quickly prepared. You know, microwaves were sort of coming on board, but microwaves weren't really that common. And a lot of foods were fried foods in the house, and I think that was very common. I think we're getting away from that, and as you mentioned, I think we're trying to emphasize more fresh-grown produce, especially salads and vegetables, and here we are in really the salad bowl of the nation, being next to Salinas.
Yes, we're lucky.
Now, what about athletes and their concern about protein, like they need to get enough protein because they feel like they're burning up muscle, or they want to make new muscle? Is it important really that they monitor their protein input in addition to their water input?
Yeah, so it is important that they're making sure that they're having enough protein on board along with good carbohydrates. So these are going to be the energy sources, because an athlete, especially a marathon runner, is burning up a lot of calories. And when we talk about weight gain or weight loss, it really is about calories in and the amount of activity to determine the number of calories out. And so with regards to someone who's a marathon runner, they're burning up a lot of extra calories, and if they're not getting enough fuel to go inside their body, then they're going to start using their own muscle because they don't have the fat to burn off.
That makes sense, Dr. Horne. Dr. Horne, it's hard for me to believe we only have a couple minutes left. Let's touch base on how you talk to someone with a condition such as diabetes and how you counsel them about diet and nutrition. Now, is it true that everyone who's diagnosed with diabetes needs to, say, take insulin shots, or are there other things they can do to be treated for their diabetes?
Yes. So the first thing is that, let's say I have a patient who comes in and they're establishing care with me, and we've gotten lab work on them, and it comes back and it shows me that their glucose level, their fasting glucose level, is elevated.
Okay, now I just want to make sure. So for our audience, the glucose level is in common terms, that's the sugar level in the bloodstream.
Correct.
Right? And you can measure that.
Correct.
And a normal range would be?
Well, we would like it to be less than 100 normally.
Okay.
Anything between 100 and 126 is thought to be pre-diabetic, and then greater than 126 is diabetes.
Okay.
And that's for fasting.
All right. So in other words, you test it when they haven't had anything to eat for a while.
That's correct.
Okay.
About 12 hours fasting.
Okay. So how might you counsel that patient about what they're supposed to eat and not eat?
So let's say I have a person who comes back and their sugar level is 105. So they haven't reached the level of the diagnosis of diabetes, but they're above where I would like them to be, the range. So they're sort of what we call a pre-diabetic. So this is an opportunity for me to counsel them about lifestyle changes so that we can head them back in the other direction as opposed to heading towards diabetes.
Right.
So what we want to do with them is I would talk to them about, one, their activity, because exercise is very helpful in helping to drive down the sugar levels. The other thing we talk about is food choices. So we would talk about simple versus complex carbohydrates. Carbohydrates are starchy foods or sweets. And what we would like to do is have them focus more on whole grains, which are complex carbohydrates, and they don't raise the level of the sugar up as high as the simple carbohydrates would, or your simple sugars. So I would talk to them about that. I'd also talk to them about getting enough rest, because sleep plays a role in a lot of things that we do in keeping us healthy. I would give them information about diabetes itself, the disease, and how it would need to be managed. And then I would allow them to ask any questions that they have, because once you talk to someone about a new disease state, it can be very unnerving. So you have lots of questions, and they need the time to be able to get their questions answered.
Well, I'm sure that's true. And Dr. Horne, it's great that you try to spend time with your patients and educate them and talk to them about things like diet and nutrition and not jumping into medicine and surgery right away. I think that's very admirable. Now, can we give contact information before we end this segment? And as I said, I can't believe how the time flies. I'd love for you to come back again.
I'd love to come back.
So Dr. Michele Horne, MD, MPH, Master's in Public Health from Yale, and USC, MD. I love that. So are you taking new patients in your group? Or?
I am currently taking new patients at our group. We're located at 10 Harris Court.
That's off 68.
That's correct. Building A on the second floor. Our phone number there is 831-333-2100.
Okay, I'm going to say that again. Dr. Michele Horne, you are board certified in internal medicine and occupational health, and you are part of Monterey Integrated Sports and Pain Associates. And the phone number is 831-333-2100.
That's correct.
Dr. Horne, thanks very much for coming on the program. A pleasure, and I hope you come on again.
I would love to. Thank you.
We'll make more time next appearance.
Thank you.
Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health television program. We're going to take a very brief pause for a very good cause.